we went over benzo overdose. Logan, what's our treatment for a benzo overdose?
It's going to be flumazenil or
Flumazenil. This is the
romazicon.
overdose. What?
Romazicon.
Flumazenil, also known as romazicon. Flumazenil being the generic name. You want to know all the generic names. So flumazenil is the generic name. Naloxone is the generic name. Okay.
I learned that the hard way.
Give me some examples of benzos.
Versed.
Okay, Versed is a trade name. What is the generic name? Midazolam. What else?
Diazepam.
Diazepam. Diazepam is the generic name for the trade name Valium. Give me another one.
Oh boy.
What is lorazepam? That's the trade name Ativan. Okay. So midazolam, diazepam, lorazepam, lots of these. Okay, no problem, Cody. So these are benzos. When do we use benzos?
Seizures.
Okay, so anti-seizure medication. What else do we use them for?
You can use them for like excited delirium, stuff like that.
Okay. We can. What else? Procedural sedation. Now, when do we have to, what kind of procedure might we need to sedate somebody? So it can be used as a part of RSI for rapid sequence intubation or induction for you need to intubate somebody. It's not even rapid. It's like it takes several minutes. But how about synchronized cardioversion?
Right.
Yeah. You're about to cardiovert an unstable symptomatic tachycardic patient. If time permits, you want to sedate them because you're about to light them up with electricity. I'm somebody who's personally been cardioverted. You don't want to remember this. How does a benzo actually work? This is crazy. We can go from anything to anything real quick. How does a benzo work? You guys want to know this or no?
I know it's more of like it's like a calming mechanism, almost like a dissociative type deal.
Like suppresses.
Okay, now, dissociative is the word. When you say the word dissociative, you want to think ketamine for that.
Right.
Okay, so it is an amnestic where it wipes out your memory, but I need you to tell me, how does it do what it does? And the reason you want to know how and why medicines work, because if you just have level 1 knowledge where you know what something is, oh, this is called a seizure. Level 2 knowledge is what do the protocols say do about it? Oh, seizure, benzo. That's most paramedics. You got to get to level 3 knowledge where you understand the how and the why, because now you're able to anticipate side effects or adverse reactions. You want to know how a benzo works? Well, since you begging, man, let's go.
Yeah, absolutely.
Let's go. Are you guys good if I go over this?
Yeah. Let's go.
Garrett, what you say? Because if Garrett says no, the answer is no.
No, I'm good with it.
Oh, dang it.
I'm interested to see if what I'm thinking is right.
I tell you what, you tell me what you're thinking, man. That's Christian talking. Christian, what you think? Let's go. Let's hear it.
I'm probably wrong, but
or be right.
Or be right. I never know. I feel like a benzo is connecting to like a muscarinic receptor, which then creates like a parasympathetic response in our body. Maybe.
So atropine and ipratropium are primarily going to be the muscarinic ones. You're on the right track. I mean, you're kind of on a similar track, but that's not exactly correct. That's okay. Keep going though. Where else would you go with this?
I mean, it's got to bind to some sort of receptor.
Yep, that sounds good. It's got to bind to something, right?
Yeah.
All right, let's go here. Let me help you out, my man. All right, so let's go over benzo. How does it actually do what it does? Okay. Now, we said that benzos are used in the place for, you got a seizure patient. They're actively seizing. We're going to give them some benzo. We're going to give them midazolam, Versed, something like that, or whatever your protocols call for. But this is how benzos work. Okay. So here's what's happening in the body. Here's a cell, right? And remember, cells go through 3 phases, all cells in the whole human body. So you learn these words like depolarization, repolarization, but you learned it in the setting of an EKG. And they told you that the P wave represents atrial depolarization And then they told you that the QRS represents ventricular depolarization, and then the T wave represents ventricular repolarization. How many have heard that kind of stuff before? Okay. Well, it was taught to you by most people just in the setting. It only came up. The only time you even used those words like depolarization, repolarization, was when you were talking about EKGs. Depolarization is not an EKG situation. It's a cell situation. It happens in every cell in the whole body. So here's what's actually going on behind the scenes. When the cell is at rest, it has a very negative charge. Okay. But in order for the cell to get excited and do whatever it's supposed to do, it has to somehow become very positively charged on the inside. It could be due to sodium rushing in. Sodium has a positive charge. When sodium rushes into the cell, now we get a lot of positive inside the cell. It could also be due to calcium influx, where calcium rushes into the cell, and now we get calcium with all of its positive charge. Either way, when the inside of the cell becomes very positive, the word for that is called depolarization. What does depolarization mean? Oh, it just means that the inside of the cell became very positive because something went in with a positive charge, whether it was sodium or calcium. But now, let's say if we have this depolarization, too much positive activity. In the brain, when I have too much positive activity happening, oh yeah, let's put a whole bunch of positive stuff going on inside the cells of the brain, the neurons. Oh yeah, the word we use for that, that's called a seizure. What's a seizure? It's just too much depolarization of the brain. Let's take that same concept and apply it somewhere else. Let's say if I'm in the heart. What if I have too much positive stuff going on? What if I have a whole bunch of calcium going on in the atria of the heart? Oh yeah, that's going to cause all kind of atrial tachyarrhythmias. Oh, that could be wandering atrial pacemaker, multifocal atrial tachycardia, supraventricular atrial tachycardia, paroxysmal supraventricular atrial tachycardia, atrial fib, atrial flutter. All of those tachyarrhythmias are just too much depolarization in the atria. But what if I have a ventricular tachyarrhythmia where I got too much depolarization happening due to too much sodium influx in the ventricles? Oh yeah, that causes ventricular fibrillation, ventricular tachycardia, monomorphic ventricular tachycardia, polymorphic ventricular tachycardia. Okay? So all those is just too much depolarization, too much depolarization. What if I have too much depolarization happening along the intestinal tract? What do I call that? Oh yeah, that's called diarrhea. What if I have too much depolarization here in a muscle? Oh yeah, what's that called? That's called a muscle cramp. What are all these situations? Depolarization, 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 depolarization. What is depolarization? Oh yeah, too much positive activity inside the cell. So in a seizure, if they're having a seizure, the reason I need to give them a benzo is they got too much positive stuff going on into the cell. How can I get rid of positive? Well, I can either, if positive is on the inside, I can pump positive out. Okay, so watch this. Let's get rid of some of this positive. Because if I'm trying to make it negative, I can get rid of positive, right? Does that make sense?
Yeah.
So is lactic acid a
Hold on, hang on a second. Because I'm cooking right now, man.
yeah, sorry.
No, I just need to complete my thought. So let's make some sense of this. I only have two ways that I can make the inside of this cell go from very positive to negative. How could I do it? I either pump positive stuff out, or how else could I make the inside negative?
Bring negative stuff in.
Potassium.
And check you out. What? I mean, you want to just take over? What if I just pump negative stuff in? Okay? Because that could, if I pump a whole bunch of negative stuff in very quickly, the inside becomes very negative. That's exactly what I need to happen to stop this seizure. Well, what molecule or what electrolyte has a negative charge? Oh yeah, that's chloride. No, potassium has a positive charge. Potassium is on the inside of the cell with a positive charge.
Okay.
Sodium is on the outside of the cell with a positive charge. Calcium is on the outside of the cell. So sodium, potassium, and calcium all have a positive charge. It's just potassium is what's called intracellular, meaning that it hangs out inside the cell. And then sodium and calcium and magnesium and phosphorus, well, not phosphorus, sodium, calcium, magnesium are extracellular, meaning they hang out outside the cell at rest. So if they're having a seizure, the way I can stop all this positive inside the cell is pump some negative in real quick. That's going to be chloride. So remember that. What is the electrolyte that has a negative charge that if I can get it inside the cell real quick, I can slow stuff down? What's that electrolyte called?
Chloride.
Chloride. So now let's tie this into a benzo. Because some kind of way I gotta get a whole bunch of negative, like chloride, inside through a chloride channel, and then boom, boom, negative, boom. Now I just stopped the seizure. Do I have a drug that can help me activate this? Oh yeah, that's a benzo. So this is the way a benzo works. Do I look like I get excited about this?
Yeah.
Seriously? For real?
Yeah.
Yeah, absolutely.
Okay. Well, cool. I actually do. So this is the way a benzo works. On this chloride channel here, let's clean it up a little. Let's just do it over. Here's your cell. Here's your chloride channel. Okay. On this chloride channel, there's what's called a GABA receptor. GABA receptor. What is GABA? Gamma amino butyric acid. Another way to think of it is the kill switch. It's the emergency brakes, the emergency shutoff for especially the brain. Okay, so it's what's called an inhibitory neurotransmitter. Neurotransmitters are ways that signals move along nerves. They transmit a message along a nerve so that something happens. You either speed things up, that's called a stimulatory neurotransmitter, or you slow things down, that's called an inhibitory neurotransmitter. In this case, if they're having a seizure, they got too much activity, I need to slow it down, so I need to inhibit something. And the best one that I could use, I might as well use the whole emergency shutoff switch for the body. That's GABA. So here's what it is. So the black thing is the cell. The blue thing is the chloride channel. The green thing is the GABA receptor. And then let's put in pink, let's put GABA. And I should have said GABA is the inhibitory neurotransmitter, but the GABA receptor is what GABA binds to. So let's erase this part. All right, so let's make sense of all this. The benzo activates GABA, which is the shutoff switch. GABA, so the benzo activates GABA. GABA attaches to the GABA receptor. The GABA receptor is located on the chloride channel that opens up the channel so that now a lot of chloride flows into the cell. That's how the seizure gets stopped. We have two ways we can do this. One of them is with a benzo. The other is with a barbiturate. Okay? Both of them work on chloride channels. Both of them activate GABA. They just do it in different ways. The benzo increases the frequency of the channel opening. That's just a fancy way to say we open the door faster. Either way, okay, if I open the door to the chloride channel faster, chloride rushes in quickly. Either way, it becomes negative on the inside of the cell. Barbiturates, what they do is they increase the duration. And the way I like to say this is barbituration. Barbituration. So barbiturates like phenobarbital, secobarbital, pentobarbital, they increase the duration of the chloride channel opening. What am I saying? One of them keeps the door open longer. This one keeps the door open faster. They both open the door. Either way, once the chloride door opens, because GABA binds to the GABA receptor on the chloride channel, opens up the door, whether we open it fast or we keep it open longer. Either way, once the door gets open, chloride rushes into the cell. The inside of the cell becomes negative. That's how a benzo works. Who wants to take it? Christian, is that what you were thinking?
Well, I had a quick question. When you said, if you go up a little bit on your screen, I forgot exactly. Okay, so when you're talking about a muscle cramp,
Yeah.
And there's too much positive, does that mean that lactic acid, because they say, oh, lactic acid is building up in your muscles, that's why you have a cramp. Does that mean lactic acid makes the cell more positive? Is that what causes it to be more positive to cause the cramping?
So it's not so much the lactic acid, but okay, so what happens here? First of all, okay, hold that thought. Like,
Okay.
I know the answer, but hold that thought for a minute.
Yep.
Let me finish
Yep.
the conversation on benzos. Remind me to come right back to lactic acid. I'll draw it out for you. So, Christian, tell me how a benzo and a barbiturate work and why we give either one of those in the setting of a seizure.
Yeah, so when you have a seizure, you have your cells that are way excited. They've got a lot of positive inside. When you introduce a benzo or a barbiturate, it has it opens, what's the channel called again?
The channel is you guys help him out. What's the channel
The
called?
chloride channel.
Chloride channel. And what's attached to the chloride channel?
GABA receptor.
GABA receptor. And what binds to the GABA receptor?
GABA.
Okay, so a benzo enhances the activity, or like it activates GABA. Benzo activates GABA, or barbiturate activates GABA. Okay, both of them activate GABA, and GABA binds to the GABA receptor. The GABA receptor is attached to the chloride channel. It turns on the chloride channel, and when it turns on, what rushes inside the cell?
Chloride.
Chloride has what charge?
Negative.
So if it has a negative charge and I pump a whole bunch of something with a negative charge inside the cell, what does the charge of the inside of the cell now become?
Negative.
And that's the way I counteract all that positive, i.e., I stop the seizure. Does that make sense? And the reason we go that route is it's the fastest way to get us there, because it's like I said, it's the shut-off valve. Like, yeah, there are a lot of things that I could do to slow things down. But when it's the brain involved and it happens to be the most important organ, I might as well go straight for the kill switch. Make sense? That's why I'm going to I'm going to go with a heavy hitting thing like GABA. Because I could have done it with a sodium channel blocker. I could have done it with a calcium channel blocker. They just take too long. And when they're having a seizure and the brain is cooking, I need it to stop in seconds. I might as well go straight for the source. Okay?
And why would we give a benzo? Yeah, why would we give a benzo instead of a barbiturate in, let's say, the field, if the barbiturate we know is going to keep that channel open longer so they don't go back to having a seizure? Why would we try and just, like, we're always trying to use something that
because, well, exactly what you're saying. Because of the half-life involved, because it's going to keep that door open longer, it's going to cause negative to go too long. And when, okay, so let's say if I have a whole lot of negative, the short answer is the benzo works faster. And it doesn't last as long, because if I give too much benzo or too much barbiturate, I can have the opposite effects. So let's say I have too much benzo or barbiturate. Let's say I give either one of these drugs. Well, now let's say I cause a whole bunch of negative, and the word for that is called repolarization. Let's say I cause a whole bunch of negative now in the brain. But let's say I have a lot of repolarization that happens in the brain stem. Oh yeah, that's where my respiratory center is. And if I cause a whole bunch of repolarization happening here, now I turn off my respiratory center. Oh yeah, when I turn off my respiratory center, what's that going to cause? Oh yeah, that's going to cause respiratory depression. Or let's call that respiratory depression. Respiratory, let's make that purple. Respiratory depression, respiratory failure, eventually respiratory arrest, eventually cardiac arrest. You've seen this pattern before, right?
Mm-hmm.
This is why when you give any benzo, you need to be prepared for intubation, because you may cause respiratory failure, respiratory arrest, cardiac arrest. This is why every patient who gets sedated or medicated like this, you need to have them on the monitor. You need to have IV access. You need to already have your intubation supplies ready to go. You need to definitely be monitoring their end-tidal CO2, because I know that with ventilation problems, I'm going to slow down respirations. They're going to hold on to CO2. CO2 is going to cause acidosis, put them in vasodilation, lead to shock, right? Does that make sense?
Absolutely.
Okay. Now, you teach this back to me. So I need you to teach me how benzos work and how barbiturates work and why I use them for a seizure.
Are you talking to me?
Yep.
Okay, so when somebody is having a seizure in the cells, there is a lot of positive charges. When you introduce a benzo or a barbiturate, you open up the channel.
What kind of channel?
Son of a gun, why can't I ever remember the name? No.
Chloride.
Chloride.
Okay.
Chloride channel. So you open up the chloride channel.
But how do first, like, it doesn't start here. The starting point is here.
Yeah.
So what's the starting point?
So the starting point is allowing GABA to attach to the GABA receptor.
Okay. And then that in turn does what?
Opens the chloride channel. And then
now I got two ways to do it. I can either open it faster or I can keep it open longer. Either way, it's got to be open. If I open it faster, what drug does that?
Barbiturate.
Nope. Remember barbiturate?
Oh yeah, barbiturate's longer. Yes,
okay.
benzo is fast.
Barbiturate. So barbiturates keep it open longer. Benzos keep it. They open it faster. Either way, it opens, and then what rushes inside the cell?
Chloride.
Chloride. And then once chloride with its negative charge goes in, the inside of the cell becomes negative. That's called repolarization. So now we counteract the depolarization. Does that make sense?
Yep.
All right, you got it?
Absolutely.